Hello and welcome to For the Love of Baby Boomers. I'm your host, Dolores Clivert, and today we have a show that is so very important. I'm excited to present it to you. We have a guest that's going to talk about Alzheimer's and dementia. Memory. You know, boomers, I know that y'all have problems out there when it comes to memory because I know I do. And so she's going to talk to us and tell us what it is, what we can do, and a whole lot more. Her name is Jill Carroll. Welcome, Jill.
Hi, how are you? It's so great to be here.
Great. Can you please start this conversation with telling us who you are and what makes you a professional in this area?
Great. Well, first off, I am a program manager with the Greater Richmond chapter of the Alzheimer's Association.
Okay.
Just going on 2 years. So that's a great question. What would make me an expert to talk today? I have learned so much over the past 2 years about the disease and about the care and the science and everything behind it. Mm-hmm. But also I became a certified dementia care practitioner, which means I've had special training on the care of people living with the disease, how to advocate for that care. And I always like to make the disclaimer that scientists like to make when they are presenting information. They always start with the disclaimer, right?
Okay,
you know, because you come out of health background, right? Mm-hmm. I am not a scientist. I'm not a doctor or a nurse. But I have learned so much in these past few years with the Alzheimer's Association.
So you have the information to give.
Yes, ma'am.
And as boomers, we need that information. So I like to start off with asking you, can you define for us what is dementia and Alzheimer's? What's the difference between the two?
That's a great question. It's actually the most common question we always get when we go into the community. So dementia actually is a general medical term for a group of symptoms. For example, memory loss, the inability to recall steps or process change in personality. It is a general term. If you think of an umbrella, okay, so you'd write the word dementia over the umbrella. And then what is causing these symptoms? The question is so important. What is causing the symptoms? What's causing the memory loss? What's causing the inability to process things, to remember the steps to a recipe? What's causing that? Alzheimer's is the most common cause to dementia. 60 to 80% of all dementia diagnoses are Alzheimer's. Then you have other types, such as vascular. Maybe you've heard of frontal temporal. Bruce Willis, the actor, is in the news with that.
And he can't speak anymore.
Frontal temporal is a type of dementia, and it, again, is similar to Alzheimer's in that the cells are dying in certain parts, and it's called that because it happens in behind the frontal lobe, the forehead, and behind the ears and stuff.
Right.
And there's other types like Lewy body. So in general, dementia is not a specific diagnosis. If you got told you just had dementia, you'd want to know what type or what's causing it.
There's more to it.
Yes.
Okay. Dementia is like broad, it
Yes.
seems like.
Absolutely.
And then you have the specific, which is Alzheimer's.
Yes.
Did I say that right?
Yes.
Okay.
Yes.
All right.
Absolutely. Yeah. Well said.
Okay. Oh, let me pat myself on the
Yes,
back.
yes.
Ooh. Okay, but yeah, seriously. So, with Alzheimer's, let us know something specific when it comes to Alzheimer's.
Absolutely. So Alzheimer's is identified by a certain protein in the brain. It's an amyloid protein, beta amyloid protein. And what happens with this is it builds up. And what happens is the neurons, we have billions of neurons in our brain, they're not, the signal is not able to be sent through, right? So with that buildup, then that area will die. Okay, so it is a progressive brain disease as the disease spreads through your brain.
Right.
And
So
I really want to emphasize disease because there's so much stigma around this disease, right?
like what? When you say stigma, where people think certain things,
They think, well,
what they think.
they're going to be embarrassed. They don't want to talk about it. We need to talk about it. I'm so grateful you wanted to have us on today because there's power with awareness. There's power with education,
Yes,
right?
yes.
And so I'm grateful for these opportunities because that negative stigma keeps people from going to get the diagnosis because they're embarrassed of what's going on, but that's not them. There's a cause to it. There's a disease.
Right.
We talk about all the other diseases, so we need to talk more about it. So this disease is progressive, and it's this amyloid plaque is building up in the brain, and it spreads to the different areas.
Well, Jill, what are some of the signs that either the person experiencing it will have or a family member will see with that
Sure.
yeah,
Yeah, like
disease?
what's a sign and what's normal aging,
Yeah.
right? Because we could all walk into the kitchen and be like, why did I walk in here?
Oh, my goodness.
Right?
I have Alzheimer's.
Right? No, but wait, that's normal aging, right?
Yeah.
But listen, if I stop and say, okay, why'd I come into the kitchen? All right, I was sitting in the family room. I was having my quiet time, my coffee. The dog barked. Oh, the dog barked. That's right. I came to the kitchen to feed the dog. So see, what I did there was I was able to retrace my
back.
steps. Mm-hmm. So with Alzheimer's, we often see first process or recall. Process and recall struggles. So if I'm not able to recall most recent information, or I'm not able to recall my steps, or I cannot follow a process anymore, right? It's okay to occasionally forget something.
Oh, yeah,
but when
okay.
we stand in front of the washing machine because we've taken out the wet clothes and we don't know where they go next.
That's an issue.
My mama, who's 86, okay, if she balances her checkbook to the penny, if one day she were to not be able to do that process anymore, I would be concerned why. So some of the warning signs are that forgetting most recently learned information, appointments, dates. Occasionally we're going to miss an appointment, but we're talking about this frequently happening.
Okay.
Not being able to follow a process that maybe we're so used to. You know, you've always followed, you know, our friend Michelle loves cooking. You've always made that coconut cake recipe and you know the steps, and now you can't follow the steps to the recipe.
Oh, my God.
You can't play, you can't play spades anymore because you don't remember the rules of the game, things that you knew. Mm-hmm. Some people, what they notice first is with language, right? They may repeat themselves a lot. They may forget words. Now, we occasionally forget words. Eventually, it may come to us later, or I might forget a name, and it might come to me later.
Right.
What we see with the disease is people will start using fewer and fewer words. Their vocabulary will get smaller, as well as you will see people invent a word for something.
Yeah.
Or even more prominent, you'll notice people just stop mid-conversation.
Because they have a brain fart.
They can't, exactly. They cannot finish the conversation.
Yeah.
And some that people don't recognize as symptoms, personality changes. For some people, you see things that never would have come out of somebody. You know, she's always been the sweetest, and all of a sudden she's cursing like a sailor.
I've heard that before. When people get older, they say that they're mean.
Old. Yes.
And they weren't mean
No,
before.
that could be a sign. You want to look at all these other things I mentioned. For some individuals, it is withdrawal. Some people will socially withdraw. So someone who's always kind of gone to those different functions, maybe they've always come to church things, and now they're withdrawing. And again, some of these things can have other causes, right?
Right, exactly.
Right? Because like we can change medications.
Yeah, that was a question I had for you. Does medication affect memories, the memory?
Yeah, absolutely. So, sometimes we can change medications and they're just not right for us.
Yeah.
And so that's why it's important to know the other warning signs that I mentioned and be like, okay, what else is going on here? Has there been a recent change to the medications? Has there been a big stressor or a different change in their life? So checking with your doctor about that would be very important to clarify.
Okay. So, yeah, it's important to write things down and because a lot of times we go to our doctors and we have things going on. And then when we get to the doctors, we don't remember what it is that we wanted to ask. So it's not just that, but it's once you take medications to take note of anything that you recognize.
Absolutely.
That's
not just
different.
For yourself, but if you're caring for someone.
Yeah.
You're helping care for your mama and you notice something's going on. play detective. Okay, wait a minute. Yep, the doctor did just change that medicine for her.
Right.
Let's find out if maybe it's the medicine.
Right.
Or any of the other things going on.
Okay. So we have about 3 more minutes. I would suspect 5, 4, 3. What we have? We have about 5 more minutes. So I want to ask you, genetics. Is that something that will affect your memory as well? You know, is it like if your mother had it or grandmother, are you destined to get it?
So, yeah, risk factors. You want to talk about risk factors?
Okay. Yeah.
So our greatest risk factor is actually age. Now, Alzheimer's is not a normal part of aging, okay? But what happens as we age, and you know this with the science background, right? But biologically, our bodies are changing. And so as we age, it is the greatest risk factor. Also, a risk factor can be our family history. If it has not skipped a generation, so let's say great-grandma, grandma, aunties, and we see a lot of people with it, we could be more at risk, okay?
Okay.
Now, that could involve lifestyle, right? Some things with family traditions include lifestyle things.
Okay. Can you give us an example of what you consider lifestyles?
Maybe it could be food, the way we eat or the way we prepare foods that then affects our health.
Okay.
And that might be something. You know, environment can increase our risk, but and they've even done studies on, for example, wildfire smoke and increased dementia risk. Now, unless we're going to get up and move, and we can't control
wildfires.
Yes, they're studying all of these things, but we can't get up and move, right?
Right.
And we can't control family history. And you mentioned genes, so let's talk about that for a second. There's 2 different types. There's risk genes and deterministic genes. Okay. A risk gene, it means you have 1 copy of the ApoE4. Okay, this just means you have an increased risk.
Okay.
We can compare that to, for example, female cancers in the BRCA2 gene, right? Cancer runs real prevalent in my family. We got tested because of my mother. My sister came back having the BRCA2 gene. I do not.
You do not. Okay.
That doesn't mean I'm not going to possibly get some kind of female cancers, and she is. But what it does mean is she gets more checkups.
Right.
She has more scans.
Because she's carrying that gene.
Because she has the gene. Okay, so there is a risk gene with Alzheimer's called the ApoE4. And then there's the deterministic. It's extremely rare, but there are some individuals who have 2 copies, meaning they got both copies of the ApoE4. And they are at pretty much determined that they would get it eventually in their life. So do you all know Chris Hemsworth, the actor who played Thor in the Avengers movies?
Yes.
Okay. He's come out and publicly shared that he has 2 copies of the ApoE4.
Okay.
And what he's doing, and I think we're going to get into this today, is a lot of the lifestyle things that can lower his risk. And what he's doing is trying to push that off, right? And push that off, and push that off, and push that off.
Okay.
Yep.
So he could lower his onset.
Exactly.
Because it's going to come.
That's what those genes.
That's what they're telling you.
Yeah.
Oh, my. For the love of baby boomers, this has been good information. It may be a little much, some of the talk, but it's good information. We're going to get ready to go for break, but before we do, I would like to say that if anybody here has a problem with falling, losing their balance or anything like that, medical alert. We have a medical alert sponsor, and please reach out to us for the